Hello guys, the topic which we are going to study today is developmental disturbances in shape of teeth. But before that, let's see what are the various developmental disturbances that affect the teeth. First is the shape of teeth that we are going to study today. Then there can be disturbance in the size of teeth, in the number of teeth, in the structure of teeth, and in the eruption. Now let's see what are the various developmental disturbances that affect the shape of teeth. So, gemination, fusion, concrescense, dilaceration, talon cusp, dens invaginatus, dens evaginatus, enamel pearl, taurodontism, and supernumerary roots are the 10 developmental disturbances in shape of teeth. Now let's study the first developmental disturbance, the gemination. Now what is gemination? Geminated teeth are anomalies which arise from an attempt at division of a single tooth germ by an invagination with resultant incomplete formation of two teeth. That means there is just an attempt to divide the tooth germ. The complete division of the tooth germ is not taking place, because of which there is incomplete formation of two teeth. Why incomplete formation of two teeth? Because the geminated teeth, the crowns are not completely separated. And if the crowns are completely separated also, the roots are the same. So what are they actually trying to say? How will the tooth structure look like? So the tooth structure will have one or two completely or incompletely separated crown. Completely or incompletely separated crown. Second thing, what about root? There will be a single root. There will be a single root. So now when there is a single root, so there will be a single root canal. Single root canal. So we can see, let's see the diagrams. First, let's look at this diagram. So you can see that the crowns are not completely separated. They are incompletely separated in this structure. See, these are the two crowns. Then you can see only one root here. Now let's look at this picture. This is a case of bilateral gemination. These are the two central incisors which have been affected. You can see there are two incompletely separated crown in each tooth. Then let's see this radiograph, what it is depicting. First, the two incompletely separated crowns, a single root, and see, there is only one root canal. Since we are describing the division of the tooth germ, now let's see if the tooth germ divides completely. So because of that complete division, we see a phenomena or a process called twinning. Twinning means the production of equivalent structures by division resulting in one normal and one supernumerary teeth. That means when the tooth germ will divide, it will give rise to two tooth germs. That means one will give rise to a normal structure and the other, the extra tooth germ, will give rise to a supernumerary tooth. So what is gemination? It is an anomaly which arises from an attempt at division of a single tooth germ by an invagination with resultant incomplete formation of two teeth. So we have studied gemination, which is the division of a single tooth germ by invagination with resultant incomplete formation of two teeth. Now let's study what is fusion. It is the union of two normally separated tooth germs. Now how is this union occurring? The union is because of some physical force or pressure. Now, on the basis of timing, when this fusion is occurring, it is of two types: complete fusion and incomplete fusion. Complete fusion is the one which occurs before calcification of the teeth, and incomplete fusion is the one which occurs when the tooth crown has been formed. So in incomplete fusion, the teeth will be united by roots only. And the fused teeth, either they have a separate root canal, each one of them, or they can also have fused root canals. Now let's look at this diagram. This diagram depicts the fusion. See, we can see two crowns and the two roots, and they are fused together. Now let's look at the radiograph with, see, this is the fused tooth, and see, there are two separate root canals running from each of the roots. Now, what are the problems we face in fusion? First is the appearance. It will not look aesthetic. Second is the spacing, because two teeth have fused together, so adjacent to that there will be spaces, and also there will be some periodontal problems. So what is fusion? It is simply the union of two normally separated tooth germs. We have studied fusion, that it is the union of two normally separated tooth germs. Now let's see what is concrescense. It is a form of fusion which occurs after the root formation has been completed. So in this case, teeth will be united by cementum only. They will be only united by cementum. Now, how does it occur? First, suppose any trauma occurs or there is crowding of teeth. So because of trauma and crowding, there will be pressure on the interdental bone, which will lead to resorption of interdental bone. Because of this resorption, the roots will come closer to each other. Roots will come close, and then there will be deposition of cementum in between those roots, and they will fuse together. There will be deposition of cementum, and this will lead to fusion. Now, the question arises, when will this occur? Can it occur before the eruption of teeth, or it only occurs after the eruption of teeth? The answer is that it can occur in both the cases. It can occur before or after the teeth have erupted. Now, what is the problem faced by the dentist? The only problem which the dentist will face is during the extraction of these teeth. Now let's see the next developmental disturbance, that is dilaceration. What is dilaceration? It refers to angulation or sharp bend or curve in the root and crown of a formed tooth. So in simple words, it is just bending of the tooth. Now how does it occur? First, there will be trauma to the tooth, the developing tooth, and then there will be change in position of the calcified portion, because of which the tooth will be formed at an angle. Now there can be one more thing. Suppose there is trauma to the deciduous tooth. This will be driven apically towards the developing permanent tooth and will cause injury to the permanent tooth, and this will lead to angulation of the permanent tooth. Now what are the related problems? The problems which a dentist will face will be during the endodontic therapy and extraction. See this radiograph. The root is bent at two places. The root canal is also bent. So there will be problem during endodontic therapy, during the RCT procedure. And also there will be problem during the process of extraction.